Hello everyone, this is Dr. Anupama from DermaOne Clinic. I work as a skin specialist and hair transplant surgeon. So in this video, I'm going to discuss about the maintenance cost of your hair transplant. There are multiple medicines and multiple procedures required after hair transplant surgery. So we are going to discuss about all those medicines, what will be the expenses that you will have to incur after the surgery. So all those things we're going to discuss in detail today. So basically there are two types of expenses. One is permanent and one is temporary. So in temporary expenses, you will have to bear those expenses for the next 2 to 3 months after the surgery, and permanent expenses will be like for long-term purpose. So first we're going to discuss the temporary expenses. So in temporary expenses, there are three things. First is multivitamins. Generally, clinics, they prescribe multivitamins for next 2 to 3 months after the surgery. Then baby shampoo is also required for 15 to 30 days after the surgery. Then PRP sessions. So PRP sessions are generally required after the surgery. The number of sessions that you need vary from clinic to clinic. Basically, what happens is most of the clinics are providing nowadays PRP sessions along with the hair transplant in their packages. Now let's talk about the permanent expenses. Basically, these are long-term expenses. It includes three things. First is minoxidil, second is finasteride, and third thing is PRP. Now all these three things, they serve two important functions. For example, in this patient, we have done the hair transplant in the front area and the crown region is being maintained using all these therapies. So these therapies basically serve two purposes. They help us in maintaining the length and thickness of the transplanted hair, because you might see age-related thinning in the transplanted area. Then they also serve a purpose of maintaining the existing hair, because in some patients, presence of existing hair stop us from doing the transplant. So in those cases, it becomes very important that we maintain these existing hair using the medical therapies which are available. Now let's discuss how you use these therapies post-surgery. So minoxidil is basically used daily after the surgery. Finasteride, the use of finasteride, it depends on your response. If the response is good just with the use of minoxidil, then we generally do not start finasteride. But if we think that the response is suboptimal, then we can start the patient on finasteride along with minoxidil. Now coming to PRP sessions, it depends on your doctor and also on your hair loss. So if there is a lot of hair loss happening even after the surgery, we can combine PRP therapies along with minoxidil and finasteride. Also, sometimes patients, they face seasonal or in between they face some amount of hair loss. So to tackle that hair loss, we can combine PRP sessions in between along with the daily minoxidil therapy. I also wanted to add one thing. Since minoxidil is known to cause little bit of dandruff, we usually add an anti-dandruff shampoo to the whole regime post-surgery. Sometimes you may also see increase in the amount of dandruff in winters. So at that time also we may have to add few anti-dandruff lotions along with the anti-dandruff shampoo. So it will also be a long-term expense. Now coming to the diet after the surgery. A lot of patients ask this question, what diet they have to take after the surgery. Basically, you have to just continue your healthy balanced diet. There's no need to go out of the way after the surgery regarding the diet. Your diet should contain all the macro and micronutrients in the recommended daily allowances. So coming to the cost of the medicines after the surgery, you will be required to spend around 1500 to 2000 rupees per month for the first 2 to 3 months after the surgery. After that, it becomes little less. You will be required to spend around 1000 to 1500 rupees per month after that. Please subscribe to our channel, and for more such videos and information, please click on the bell icon. You can also follow us on Facebook, Twitter and Instagram.